Hello. My name is Courtney, otherwise known as Courtney.Speech online. I am a certified speech language pathologist here to help your child learn to talk, or a client that you're working with. No matter who it is to you, they're important, and we're going to teach them language together. Come on, let's do it. I have a few things that I want to talk to you about today, and they're all quite important. And honestly, you as a parent or another professional, no matter who you are, you can make a huge impact on how a child learns. Want to know how? Well, there's actually a lot of studies and research out there that supports that a parent or another individual or a caregiver can also help a child learn language in the same way that a speech language pathologist can do. All that you need to know is what I'm about to teach you, plus a little bit more, but we're going to get you started today. So, all in all, you have the power. You have so much right at your fingertips. You just need to learn from me and practice what I'm about to preach to you, and you can do it. Your child can learn a lot of language. Keep in mind that, of course, there are other different barriers that could come into play, and if your child does not respond to some of these things within, let's say, a couple weeks or a couple months, then I would definitely, if you were not already concerned, I would start looking into speech language pathology, look into getting a speech language pathologist to work with your child and get them evaluated. It is never too early to evaluate them. It is never too late to evaluate them, and it is so important that you get them the support that they need. The earlier, the better, especially because if they are between the years of 0 and 3, we know that a child's brain is 80% developed by the time they turn 4 years old. 4 years old. Can you believe that? That means that also it goes to show that the amount of neuroplasticity or brain ability to adapt and learn and grow at such a young age is so important. They have the most neuroplasticity from the ages of 0 to 3 in particular. And that is why early intervention is so important. That is why if you live in the United States, they prioritize it. They have different programs in every single state that supports this. And in most states, you can get into it for absolutely free. And in every state, you can get, at least as of now, you can get into it for every state for an evaluation for free. Keep in mind that a lot of these services are based on wait lists, and some of the states have very short wait lists, some of the states have very long wait lists. But either way, it's important. If you do not live in the States, unfortunately, I cannot speak to what programs your country has to offer, but I would hope that it's something, because it is such an important time in development. If you are at all concerned for your child's language abilities or lack thereof, you can get into early intervention in most states, if not all, without a doctor's referral. You do not need your pediatrician to tell you that your child needs speech therapy or occupational therapy or PT. Most states also, I think, if not all, also do developmental interventionists, which are kind of a catch-all. They do a lot of just general development support, and like I said, OT and PT and speech as well. So there's so much there for you right at your fingertips. It's crazy not to take advantage of it, and it's never a bad thing to get them assessed. Some pediatricians will say, "Oh, just wait and see," but I would highly encourage you not to do that. There are so many SLPs out there in the world that hate that saying and hate that doctors are still saying it, because of how important that time in early intervention is and how important 0 to 3 years old is. And a lot of doctors will have patients wait until 2 or 3 years old, and that's just not great. One other note to keep in mind is that milestones that you will see online or wherever, if it is a direct milestone, it is 10th percentile, which means 90% of kids have higher skill levels than that skill. And so if your child is only meeting those milestones, that means they most likely would still qualify for speech language therapy and are delayed, or behind at the very least. And so those things are things to keep in mind. If you follow me, watch some of my TikTok videos or my videos on whatever platform you follow me on, it is important to note that a lot of the information that I put out there is based on averages, because I think it's more important that you know the average of where children are than where the 10th percentile is. Okay, with that, let's get on into it. That's my little spiel. I do want to talk about a few more things before we get into a couple tips, but this is going to be a big lots of information packed into this video just for you. So let's keep going. So a couple other things that I think you need to know. What is a delay versus a disorder? Essentially, in layman's terms, I'm going to wrap this up pretty quick, but essentially a speech or language delay is really just a way of labeling that a child is behind before we realize that it is chronic, or before it, just in case they do spontaneously recover. There is a lot of information in the research that says that a lot of children can spontaneously recover, some of which without speech therapy services. That being said, I would encourage you to still seek it out if you have any concerns, just because we know that with the help of a speech language pathologist, children can have a much greater impact we can have a much greater impact in their development, and they have a higher likelihood of recovering, let's say, from this speech or language delay. That to be said, when it is more chronic, when it does extend past a couple years old, then we consider it a speech or language disorder. This is not something to be incredibly concerned about. Some disorders kids can still recover from or age out of, essentially, depending on where they're at, how much therapy they receive, and how they do over time. So there's a lot of ebbs and flows to this, and every single child is different, but just something to keep in mind. On that note, there's a difference between speech and language. Speech is the output of what you hear. It is the sounds coming out of my mouth right now. Language and how you create those sounds. Language is how you understand and express vocabulary, essentially, or different words that you hear and understand. So language is more based in the understanding of vocabulary, the understanding of following directions, the understanding of concepts, and also the output of those things. Grammar, essentially everything that is not how it sounds, most all of it is enveloped within the bubble of language. So a child can be receptively behind or receptively delayed or disordered, and they can also be expressively behind, delayed, or disordered, or they can be a mixture of the two. So if it is not articulation, phonology, how they are making sounds, then it could potentially be their language, in that they're receptively delayed, expressively delayed, or disordered, as we've talked about, or that they are a mixed version of the two. Most likely, children are typically either expressively delayed, their expressive language is delayed, or disordered, or they're have a mixed delay. This can be caused by a various amount of things, some of which can be idiopathic in that we do not understand and do not have direct causation for why those things may happen. It is to be noted that if a child's family has a history of any of these things, they are more likely to present with these delays or disorders, though it does not mean that it will happen. I want to make it very, very clear that if you are a parent, or if you are feeling any guilt, please take that all off your shoulders and leave it at the door right now. Right now, do it, take it off, leave it at the door, because it's not your fault. Your child's language development and speech development has really not much to do with you. You can have a huge impact and you can support them, but you did not cause it, and it is not your fault that your child is behind or delayed or whatever. Let that sink in before we can move on, okay? It's not your fault, I promise. And there's so many things you can do, and one of them is being here today. And for that reason, I'm so proud of you. Okay, so when your child is evaluated by a speech language pathologist, they may or may not be diagnosed with one of those things. They also may have other things going on. There's many reasons as to why kids can present with certain disorders or delays. Just a few things to keep in mind. Something to start off with that I want to say pretty quickly is that sign language and AAC can really support a child with their language and with their language growth, and actually support their speech output as well. How? Well, let me explain AAC first. AAC stands for Augmentative and Alternative Communication. This is, oh my gosh, this cloud envelops so many things. Your gestures, your facial expressions. Huh? All AAC, Augmentative or Alternative Communication. I am communicating. If I am throwing my brows at you, I'm communicating something to you, that I am angry, that I'm frustrated, that I'm bored, whatever it may be. I'm communicating something. By gesturing and pointing to things, I'm communicating something. So before we even work on necessarily a child's output or what they're saying, there's a lot of things that we work on that do not involve speech. And they have to have some of these skills before they start talking, some of which are purely just the understanding. If a child does not understand what a dog is, they're definitely not going to be out there pointing to dogs and labeling them and telling me it's a dog, because they don't understand that this thing that you're showing them in a picture is a dog. So they're not going to say it, of course, right? AAC is also can be considered a device or a something that a child can talk with without using their speech or their mouth to talk. This typically looks like something like an iPad that has speech output. Here, let me show you mine. Okay, this is just one fine example of an AAC device. There are many, 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 many programs out there, but this guy will get us started off. This is called Lamp Words for Life. It is one of the many programs that are available that you can purchase. I would not necessarily recommend that you do this without the support of a speech language pathologist, though I would argue that it probably would not hinder your child. This is, lamp is a little bit specific and I'm not going to get into it, but essentially if I tap on different buttons,
on, to, no, like,
I can say different things. So this is used to help a child communicate, or any individual communicate, if they do not have the ability to do so with their mouth. This is also a supportive device in that some that do talk that have trouble talking in certain situations, or just generally communicating is difficult for them. This can also be really, really supportive for them.